put your hands by your side? And can you put your glasses back on your eyes? You are a good listener. I got interested in dentistry from a really young age. I remember going to my pediatric dentist and thinking it was a lot of fun. The staff was very friendly. They made each child feel very comfortable when they came in. And so I knew when I came out into practice, I wanted to create a similar practice environment. So it's a first dental visit, so what's really important is to make sure that this 4-year-old who doesn't speak English has a really great first dental experience. Hi, hola Gisela.
¿Se puede decir hola?
¿Cómo se llama? Bien. Me llamo Doctora Meeske. When kids get a lot of cavities, they have lots of problems with other kinds of illnesses as well. They miss school. And it also becomes very costly for families. And so when we have the opportunity to work with a young family on how to prevent tooth decay, it really makes a big difference in the health we see of that child as they grow up and they move into adulthood. How we're gonna count? 1, 2, 3, 4, 5. Manzur's turn. Do you know how to count? Mentoring is important to me because so many times we see new dentists come out and they're really good at the clinical skills, but they don't always know how to run the small business part of it. They may not know how to lean into a healthcare problem within their community. Here in rural Nebraska, we have a lot of kids that come from families with smaller incomes. And so it's important to teach students that you have to meet those families where they're at and really help them understand, number one, they're welcome in your practice. Number two, we're here to help their kids have successful dental visits and also to make sure that they don't suffer from dental disease. That appliance looks great. You are doing a great job and you are good to go. Our practice had 5 senior dental students come out and all were amazing, all from different backgrounds. But one stood out in particular. Good to see you. How's the baby?
I completed a 2-week rotation here in Grand Island and Hastings, Nebraska with Dr. Meeske. I hadn't met her before and we just kind of really hit it off from the first day, just how energetic she is and encouraging she is to young dental students who are just starting out.
I noticed right away that Allie had a special way of connecting with kids that were a little more anxious about their dental care. I said, Allie, you are really perceptive at these families that come in that are really more of your challenging families. And she said, I grew up in a family with a single mom, and we were faced with all kinds of challenges growing up. But I remember every teacher and every coach and every pastor and every parent in the neighborhood, but most particularly my dentist who made sure that my siblings and I always had a place to go. And she said, if I wouldn't have had all those incredible adults throughout my childhood, I never would have had the support to do well in school, the courage to apply for dental school, and Allie ended up graduating at the top of her class.
It's very important to have a mentor, that I have someone like Dr. Meeske to reach out to on a daily basis. Seeing her still be so successful in her job and in her field and how much she's been able to do for Nebraska as a whole, to be able to reach out to her the rest of my career is going to be a huge blessing and a huge help.
So these are basically lateral incisor retention hooks, and it's just going to keep those 4 incisors like this. When you get to work with kids all day, you don't go a day where some kid says something or does something that makes you smile. And I think it's incredible when you can numb up a kid and get them out of pain. And they are so excited to be there because they got to play basketball or pick a prize, or you just gave them your attention that day.